The number of coronavirus infections in Victoria has jumped by more than 20 cases, the majority linked to a Brooklyn meat processing plant. Reid Butler's there. Reid, what's the company said?
Pete, I've spoken to a representative from Cedar Meats today, and they say the company first became aware that an employee had tested positive for COVID-19 on Monday last week. Since then, we know that infections linked to the facility have skyrocketed, yet the public has been kept in the dark. Why? Well, the government says in this case, it's up to the business to come clean. Now linked to more than 30 infections, this abattoir is at the centre of one of the biggest coronavirus clusters Victoria has seen. But if the people in power had their way, we would never have known about it.
That is a judgment that's made by the public health team.
My team's just in the role of doing the public health follow-up of these places. Naming it is not part of what's required for us to do our work.
How about helping us all out and letting us know what exactly is going on?
There were 22 new cases recorded in the past 24 hours, bringing the state's total to just over 1,400. 19 of the new infections are linked to the Cedar Meats facility, 34 cases now associated with that cluster.
It's not a risk to the general community and it's not going to get out of control, and it is shut down.
In the end, Cedar Meats identified itself. The company first became aware an employee had tested positive a week ago. 4 other staff members were found to have contracted the virus on Wednesday. By Friday, all 350 of the facility's staff had been tested.
COVID will be detected in amongst us, but we need to know where those sites are, because we need to be able to take those specific hygiene-related efforts to ensure that we don't become infected.
Across Victoria, 13,000 people were tested yesterday as part of a 2-week blitz. With a target of 100,000 tests, we've now soared past the halfway mark. Almost 56,000 people have been checked. The results of the mobile testing will help the government decide which restrictions will be eased when the state of emergency is reviewed next Monday. Victorians also need to keep following the rules if they want measures relaxed. In the past 24 hours, Victoria Police conducted 879 spot checks, issuing 44 fines. Breaches included 5 people found drinking and partying, 1 person attempting to run from police by jumping the back fence.
If we stay at home, then we will have options.
Reid Butler, 9 News.
There have now been more than 3.5 million confirmed cases of COVID-19 around the world and 240,000 fatalities due to the virus.
But with infection rates in Australia relatively low, social restrictions in some states have been eased. So what will that mean in the fight to combat the pandemic? Are we finally out of the woods, or could these changes be too much too soon?
And for more, we're joined by infectious disease physician, microbiologist and ANU Professor Dr Peter Collignon, live from Canberra. Good afternoon, Professor. Now, in your opinion, what does the easing of restrictions over the weekend mean for the spread of the virus?
Well, so far, Australia has been very successful at keeping the spread really low. We haven't had lockdowns in most of Australia, yet we've been able to stop transmission. So that's very good news. We're not out of the woods, though, because this virus is going to be around with us, unfortunately, for a couple of years or even longer. And until we can actually get a good vaccine that is effective and safe, we're going to have to keep on a lot of restrictions we've already got. But that doesn't mean we all have to be locked up in our houses. We know how this virus transmits. It transmits via our houses, via our hands and via our droplets. So that if we actually keep on washing our hands, keep as much as possible our distance from other people, you meaning 1.5 metres to 2 metres, stay outside more than inside. All of that markedly decreases the risk. It doesn't make the risk zero, but it means it's much less than if we don't do those things. And so far, we've actually turned the curve right to very low levels, with now only maybe 10 cases per day occurring in Australia, which is very good news. But we need to keep it there, and particularly as winter comes up.
Yes, that's right. Well, we've actually seen in some states a sudden cold snap. So does this weather, do you think, impact the spread?
Well, most respiratory viruses, whether it's the common cold virus or influenza, and I presume probably this virus, will be easier to spread during winter. Maybe that's because we're more inside, closer together, and maybe it's got something to do with lower humidity. But what we do know is that viruses spread more often in winter. And that may be why we're seeing such bad results in New York and London and Europe, is because they were in winter. Although the difference with us is that there it was probably spreading for a couple of months before people realised it. That's not going to be the case in Australia because we've got lots of testing. And I suspect coming up, anybody with any respiratory illness at all will get a test. So very early on, we'll know if it's COVID, and we'll be able to quarantine those close people around them and make sure it's a small cluster rather than an uncontrolled epidemic.
Yeah. Now, data suggests that kids are very unlikely to contract COVID-19, but we've seen reports recently from the UK that show a spike in children presenting with symptoms of what they call Kawasaki disease. Just explain what that is, and should we be concerned as far as a connection to COVID-19 is concerned?
Well, children, particularly under 15, do get this infection, but just markedly less than adults, but they're not immune. The Kawasaki disease is an inflammation of blood vessels, even in the blood vessels involving the heart, that affects children. It's got numerous possibilities as causes, but we haven't actually found out which one, and it's been around for a long time. What they've reported in England was a number of cases, I think about 20. Interestingly, not all of them appeared to have had COVID, just a minority. So there's still a lot we don't know about what the causes might be. But again, this is where we need to do research. We need to see, is there another virus that went along with it that's causing this? And what is the cause? Because if we can prevent it, that is good for a disease that's been around for a long time, well before COVID.
There's been some controversy, Peter, about using the Ebola drug remdesivir as a COVID-19 cure. What do we know about this?
Well, what we do know is from a study in China is it wasn't all that successful. They had a couple of hundred people in each arm, and basically it didn't make much difference to the death rate seen or really the amount of virus. Now, there was another study, a larger one done in the US in what they call by the NIH, but the only information we've got from that is a press release that sort of came out of the White House. So that's a bit of a worry. It didn't really seem to make a lot of difference even in that study, even though it was promoted, to actually decrease mortality much. It was supposedly you got people getting better 4 or 5 days earlier. That can be an advantage, but to put this in perspective, when penicillin came around for treating infections when we had no antibiotics, the mortality rate dropped, if you had it in your blood, a bug called the pneumonia germ, from 90% down to 10%. We're not seeing that with this drug. So while this may have some benefit, it still really needs a lot of study, a lot of trials to make sure that what benefits are we getting, how big is it, and what are the side effect profile? Because unfortunately, the study in the Lancet from China really showed that it didn't make much difference to the people receiving it versus the one that got placebo.
Yeah, Professor, we're hearing that our professional footy codes are aiming to restart. That's the NRL and potentially the AFL. What does that mean for contact sports? Because we're hearing even sports just for civilians are potentially about to reopen, maybe even post this Friday. But what does it mean for contact sports moving forward? Is this a wise move?
Well, I have reservations, I must say. I mean, we know this is spread predominantly by droplets, and therefore it's our hands that are important and how far we can keep from other people who we don't live with. And even in our own home, if somebody's sick, keeping away from them. In rugby in particular, I can't see how in a scrum you're going to keep 1.5 metre away from other people. And the reality is there's lots of teams with their families, so you do wonder, and particularly because it's winter when the risk is a bit higher, are we better off playing cricket this winter where people can keep much further apart rather than particularly rugby with scrums? But I guess we'll wait and see. At least we'll have a lot of testing. But, to me, I think for this winter we've got to keep a lot of hand washing, physical distancing, and I think that's a bit difficult with a lot of the winter sport we normally play in winter.
Yeah,
Interesting.
Definitely. Complete elimination of COVID-19 is obviously the most desirable outcome, but is that even possible, or is this something you think that will continue year after year, a bit like flu season?
Well, I unfortunately think elimination's unlikely. New Zealand is trying that, and I think Victoria is as well. But from what I can see of the New Zealand data, yes, they've had one day now without any new cases, but a lot of states in Australia have had that for much longer without the severe restrictions. So unfortunately, because there's a lot of people that get mild illness or subclinical illness and it doesn't appear to be much, I think it's going to be around in low numbers like we've got now. That's 10 cases a day, maybe the whole of Australia, 100 a week. and we'll keep it at low levels because we're very good at testing and chasing up people. But elimination, I think, is a problem that we're probably not going to get to. And the real worry is if people think we're eliminated, if we drop our precautions, you know, the hand hygiene, the physical distancing, then it could easily come back and really bite us hard. And the other problem is it's all over the world and it's not going to disappear. So, you know, it'll just come back and where it can be at square one if we're not doing all the appropriate things to decrease the risk from spread as much as possible.
ANU Professor Dr. Peter Collignon, we value your insight and thanks for your time today.
Thanks so much. Thank you.